So I would like to welcome Jasmine Matheson. Today she's going to be presenting Ukrainian newcomers to Washington State and TB. Jasmine Matheson has a master's in public health and is a senior epidemiologist supervisor and a refugee health coordinator for us at the Washington State Department of Health. She's been with Washington State Department of Health for 11 years. And previously, she's been with public health since 2005. Previously, she's been in Virginia doing public health work there and Auckland Regional Public Health Service in New Zealand. She graduated with a master's in public health infectious disease concentration from University of California, Berkeley. And our Washington State TB program relies greatly on her leadership and on the topic of immigrants and refugees. And it's always a gift to collaborate with her team on TB. Welcome.
Thanks so much, Lana. It's always a pleasure to be here and so fun to see the TB Echo community. Grateful to be here to share a little bit more about Ukrainian newcomers to Washington State and TB. I think if you take one thing away from this today is that we have a big Slavic community and a big Ukrainian community in Washington State. And there are a lot of different immigration visa pathways. And with these come different TB screening requirements. And so please don't hesitate to reach out if you have patients where there are questions or you're trying to track something down. This area does seem to be evolving a little bit, so I'll share the information we have available as of today and just some background pieces as well. But feel free to drop questions in the chat if we can answer anything in real time. So I'll do some real quick refugee resettlement background, talk a little bit about some of the pathways to the US for Ukrainian nationals, and then a bit about health programs and benefits eligibility, and finally TB considerations. So when we talk about health in our state and we focus on new arrivals, we're really thinking not just about what happens in the doctor's office, but some of our bigger picture systems, the experiences and factors that let people be healthy and successful as they resettle here in our state. And this is built on partnerships primarily between resettlement agencies, local health departments, primary care, TB programs, community-based organizations, and many other partners. So we're always so grateful for the expertise that the TB community brings. So to set some baseline expectations here around definitions, the definition of a refugee is shown on this slide. And it includes persons who have a well-founded fear of persecution on account of race, religion, nationality, political opinion, or membership in a particular social group. In addition to refugees, there's other classifications of immigration status that make people eligible for refugee benefits, similarly to the services and things that happen for refugees post-arrival. Washington State is home to a diverse refugee community. We have been one of the top 10 states for refugee arrivals since the current version of the program was stood up in 1980. This map shows the location of refugee resettlement agencies across Washington State. Refugees can choose to resettle in any area of the state or the US, but most initially do resettle within counties that are shown here. Typically about 70% of our newly arriving refugees are in the King, Snohomish, and Pierce County region. So this slide shows refugee arrivals to Washington State. In the past 5 decades, we've had more than 140,000 people resettled in Washington State. This includes, in the past decade, about 6,500 Ukrainians who've resettled in our state through the US Refugee Admissions Program. The chart here shows the total number of individuals resettled in Washington by visa type. The blue bars reflect refugee arrivals. The yellow bars are persons with special immigrant visa holder status. Those are folks from Iraq or Afghanistan. And the green bar shows the number of people resettled through the Afghan Placement and Assistance Program this past federal fiscal year. While in past years, Washington State has welcomed over 3,900 people annually, the past couple years, we've had far fewer newly arriving refugees. And this year has seen a really rapid growth and rebuilding of the program to welcome new arrivals from Afghanistan in particular, and then more recently, new arrivals from Ukraine. So with the ongoing conflict in Ukraine, we've really seen people entering the US through different immigration visa pathways. I tried to capture a couple of them in this slide, and the health requirements that are part of the process varies by immigration pathway. So starting on the top line, I think many folks on this call are familiar with this, particularly if you have refugee resettlement agencies in your jurisdiction. So for refugees, people are applying overseas. They are receiving an overseas immigration medical screening process. And so if you're familiar with Class B follow-up, that is the process that's driven by the CDC technical instructions overseas. And post-resettlement local health jurisdictions may be receiving Class B notifications indicating follow-up. The second row shows folks with humanitarian parole status who traveled independently. And these are people who would have traveled from Ukraine on their own and been granted humanitarian parole at the border. So for example, people who traveled to the US and entered via the US-Mexico border might enter via this process. CDC has shared that for people traveling independently, typically they do not have health requirements that are part of this parole status. In addition, there's no overseas medical screening process that is part of this pathway. The bottom row describes the process for people who are arriving through the new program called Uniting for Ukraine. These folks are also receiving humanitarian parole status. They, before arrival, need to complete a form that attests to receiving vaccinations for measles, polio, and COVID-19 before arrival, as long as those vaccinations are available in the country they're departing from. After arrival, they also have to complete TB screening with an IGRA within 14 days after arrival. Copies of these records are maintained only by the client, and local health departments should not expect to receive any copies of any of this information. And the language on this slide shows the attestation that is part of the Uniting for Ukraine program. So it's basically attesting to the fact that they've completed the IGRA within the recommended window of time. I will note that there's ongoing discussion based upon feedback that we've been providing, as well as others around the country, around that 14-day timeline and the challenge it is for somebody to arrive in the country and access primary care within 14 days and complete that exam. This slide is just a contrast between the refugee arrivals health milestones and the health milestones for people arriving through Uniting for Ukraine. Again, just emphasizing the fact that people coming in with humanitarian parole status will not have had the TB screening completed overseas per the CDC technical instructions. And so as clinicians are seeing people in the community, really just considering what may have been done before arrival is different than what we typically see for newly arriving refugee groups. All right, so folks with who are arriving from Ukraine as refugees or humanitarian parolees are eligible for Apple Health and for domestic health screening examinations. A list of our refugee health screening clinics around Washington State is on this slide, and I know I've noticed many names on this call who have all that expertise and are joining today, so feel free to contribute their thoughts as well as they started to see clients. During that health screening examination, the factors that we cover are listed here. Tuberculosis is one, as you'll note. As I mentioned, the eligibility for programs has updated recently. So as of May 21st, 2022, the additional Ukraine Supplemental Appropriations Act of 2022 was passed. This made Ukrainians and other people displaced by the conflict in Ukraine eligible to receive federal and state funded services and programs similar to that of refugees. So this chart is our attempt to capture some of that difference in status and difference in program eligibility. So one thing to note is that we do have folks who are here in our state who we've heard about who arrived either on tourist visas or who have temporary protected status. Those individuals will not have had any health screening for tuberculosis or any requirements to do so. They are also not eligible for the post-arrival services typically, including Apple Health or domestic health screening, except in limited cases. So this chart shows the overseas immunizations, overseas TB screening, and domestic TB screening based upon the immigration pathway. And again, overseas, the only group that will receive overseas TB screening are refugees. People entering under any other pathway may receive some TB screening post-arrival, but you can see there are gaps there as well in terms of whether or not that is recommended or folks are eligible. So switching gears to TB in Ukraine, Ukraine is considered a high priority country in the WHO European region, and it does have a high burden of multi-drug resistant tuberculosis. TB incidence has decreased in Ukraine over the last 15 years. The overall prevalence and mortality does remain high. So clinicians should maintain a high index of suspicion for TB disease in those from Ukraine presenting with signs or symptoms. The data on this slide is from our refugee health screening program here in Washington State and shows the IGRA positivity for individuals who received a health screening examination between federal fiscal year 2017 and 2019. During this period, 3,404 people from Ukraine were screened for TB using an IGRA and 9% were positive. So finally, these recommendations are from a draft health alert that David Miller kindly helped put together, and we're hoping to be able to share out soon. But in terms of recommendations for community-based clinicians, really the core ones are to consider tuberculosis in patients arriving from Ukraine. And so they list out, of course, the signs and symptoms, and really to make sure that they're contacting local public health and the appropriate diagnostic workup, and really highlighting for our local clinicians the burden of multi-drug resistant TB. And of course, emphasizing that patients ages 2 and older should receive an IGRA, regardless of symptoms, and screen for TB infection. I will also note that the immigration requirement associated with Uniting for Ukraine is for people ages 2 and older. There isn't a requirement for the younger children included in that program. So there's some links here with additional resources. We've added a page to our Department of Health website, which has a lot of different links to different eligibility, as well as translated resources around TB and other topics for health education, with links to the resources in Ukrainian and Russian. There's also links to the Uniting for Ukraine program from the federal government, and the Southeastern National TB Center has a nice cultural quick reference guide as well. And with that, I will stop and happy to take any questions.